the community needs assessment that the United Way had recently conducted.
Hi, everyone. Thanks, Dee. I think also if anyone has any questions, you're welcome to put them in the chat, and we'll be monitoring that to get to some of those answers later on in the presentation. So I wanted to give you all a little update on the results of the 2019 Community Needs Assessment. So the 2019 Community Needs Assessment was a 12-month project that began back in the spring of 2019 and concluded in the spring of 2020, which is important to emphasize. All of the data that was collected was pre-COVID, pre-shutdowns, pre-everything. We consulted with an independent research company that was brought in to work with 6 local funders: the Community Foundation, Johns Island Service League, Johns Island Foundation, Indian River County, the Department of Health, Indian River Club, and United Way. It was the first time in over a decade that something of this magnitude was assessed in our county. We concluded over 1,400 surveys with 12 focus groups were completed with the help of 50 nonprofits to help glean the specific needs and the perceptions of our community. The research utilized other recent reports and studies to examine 6 domains: children, economic opportunity and employment, health, housing, and seniors. We do want you to recognize that the committee was not dismissing the importance of things like the environment, animals, the arts, and civic activity. It's just that these 6 were the ones that rose to the top as the most critical need areas. The pandemic exposed exactly the issues of economic fragility and the widespread hardships that this data revealed. It's a point in time snapshot on the conditions across the county. By showing how many households were struggling then, the research provides the backstory as to why the COVID-19 crisis is having such a devastating economic impact. The data is especially important now to help stakeholders identify the most vulnerable in our community and direct programming and resources to assist them throughout the pandemic and the recovery that is following. As we move forward, the data can also be used to estimate the impact of the crisis over time and provide an important baseline for the changes to come. So we had some key insights. No surprises here for many of you. Our population is aging. Our population is diversifying. Collaboration and coordination is necessary to address the complex systemic problems and improve overall service quality in our community. And most of all, which will be the bulk of our conversation today, the wealth divide is increasing in our county. So first, like I said, our population is aging. We are the 6th oldest county in the country. We are beginning to experience what many in the social service world are calling the silver tsunami. Adults 65 and older are the fastest growing age group. This 65 plus group will constitute 36% of the Indian River County population by 2040. A recent study also claims that 50% of 10-year-olds today will live to be 100 years old. So think about what that is going to mean to Indian River County in the years to come. What services will that group need? What will appropriate housing look like for the elderly to age in place? What will be required for transportation? What will be the medical services necessary? How will technology adapt? And since this is Impact 100 and notably a group of women, take a look at that one statistic. 75% of the seniors who live alone in Indian River County are women. Of the over 55 population in our community, we had 795 falls last year. We have one of the highest fall rates in the state. Our death rate from falls is 56.9, while the state's is only 44.8. And I realize falling isn't the greatest critical issue for our community, but many of you know the stories and have heard, the greatest worry that a slip and fall can result in a broken arm or a hip, and then without appropriate care, there can be a quick decline in health. So for our senior population, this is very significant. Our population is diversifying. Hispanics and Latinos are the fastest growing minority group, and they will increase from 6% to 18% of the population by 2040. perhaps more because this is such a transient population. Think about how that impacts the expectations on how children are taught, how medical services are provided, how first responders interact with victims. The cultural and language differences will be ever evolving and continue to diversify. So, as I said, the wealth divide is increasing. One of the things that came out of the needs assessment was that the rich and retired need to meet the working poor. The Wall Street Journal often refers to Indian River because we are one of the top 10 richest counties in Florida. And we have one of the highest Gini coefficients. Now, many of you probably have not heard that term, but what that means is we have the 10th highest income gap between the richest of rich and the poorest of poor in the country. So we are number 10 in the entire United States for the largest gap between the top 1% and the bottom 99% of earners. And at 3 miles from the most expensive home on Gem Island at Johns Island, over the bridge, you'll find some over 1,000 homes in our county with no power source. That means they have no electricity, no heat, no air conditioning. Right now, there are 1,000 homes without connectivity. There are 138 homes with substandard plumbing and 232 homes with substandard kitchens. And remember, these are what we know of. These are reported homes in these conditions. The average annual income for the 1% in Indian River County is $2.9 million. The average income for the rest, everyone else, 99%, is $43,373. The cost of living in a community like ours is an important factor to consider when evaluating the quality of life available to the residents, and many of the basic costs of living are not taken into consideration, nor is the location when calculating the federal poverty level. We often cite that clients are living below poverty or at the poverty line. Well, that definition hasn't been updated since the mid-1970s. So its calculation is based off a half a century's old cost of living calculation. So alternative measures of income and poverty need to be understood so that we realize the economic conditions of the residents in the community. As the cost of living in an area increases, lower income families may have difficulty meeting their basic needs if their wages don't rise with the increasing cost. Much of the needs assessment findings came out that the economic inequalities in our community are persistent. In an effort to put a name to these families living on the cusp of true poverty, United Way created what we call the ALICE report. This is our effort to put a name and a face to the often overlooked working poor. So meet Alice. I bet many of you have even talked to or chatted with Alice today. Alice is an acronym. Alice refers to the very sizable population in our community that is asset limited, income constrained, employed. Employed is the critical word here. Alice represents those who work hard, maybe holding 2 jobs, but due to the high cost of basic household necessities and factors often beyond their control, they live paycheck to paycheck. For many of them, a small emergency can quickly become a major financial crisis. As a population, Alice is above the federal poverty level, yet has a very difficult time affording the basics of housing, food, healthcare, childcare, and transportation, despite working hard. In Indian River County, 44% of our population are Alice and below. As a framework, Alice is an opportunity to remove some of the stigmas and stereotypes that are attached to other terms such as working poor, and to see these individuals as valued family members, neighbors, friends, and critical members of our community. Even using the most conservative cost scenarios for a family's monthly expenses, these Alice families live on the brink of financial disaster every day and are at risk of falling over the precipice when an emergency comes along. Unable to pay for a broken down car, for example, they may not be able to get to work, risk lose their job, and then that leads to a downward spiral that can put them at risk of going hungry or even becoming homeless. When these and other circumstances beyond their control, like a pandemic, occur, Alice households, as well as our community, suffers. A child loses a teacher, who's built a rapport in a preschool class. A parent loses a home health aide who made sure they took their proper medications. And we might lose the mechanic who keeps our car running smoothly. In other words, our friend Alice works hard and has very little in the bank and has a household survival budget that essentially keeps it that way. Alice represents millions of households in Florida and over 28,000 households in Indian River County. That's households, not just individuals. The success of our community is directly related to the financial stability of its members. So as I said, 44% of Indian River County's families struggle to pay their bills and keep their head above the fiscal waters before the pandemic and all of the economic turmoil that it has caused. So I encourage you to think about friends, family members, coworkers, neighbors, and others who you regularly interact with who may be Alice. Compare your household budget to the Alice survival budget. That's about $60,000 for a family of 4 using true costs in Indian River County. This will help you more fully understand the fiscal challenges that Alice families have and how you, me, and all of us can help make a difference in their lives. Alice is a significant part of and plays a significant role in our community. Alice provides childcare for your children and grandchildren. Alice provides home health care for your parents. Alice is the server at your favorite beachside restaurant. Alice rotates your tires and answers the phone when you make a doctor's appointment, draws your blood, and hands you your morning latte. Think of the steady stream of vehicles most morning on the bridge, coming in to clean pools, handle yard work, and clean homes. Who's behind the wheel of those vehicles? Alice is. Alice keeps us healthy and helps make our quality of life possible. Alice is what makes Vero Beach a very desirable place to live. Alice are citizens who work hard, but again, live above the federal poverty level, so they do not qualify for or rely on public assistance, but they still can't consistently afford the cost of living. Some other factors to take into account for the specific Alice population of Indian River County. The seasonal nature of our workforce can literally fluctuate with the weather. Working extra shifts can change their income for an entire season. An early Easter means less income as the snowbirds leave and don't necessarily need a cleaning person and aren't eating out at restaurants. Things like hurricane and red tide can dramatically impact Alice's hard work. The affluence here also drives up the rent on the other side of the bridge. Landlords can cover a full year's occupancy with rent from just 3 months from a snowbird, much less an economic shutdown for the industry completely employed by Alice workers. We know that the toxic stress and short finances of overworked parents spills over into a child's learning outcomes. The real impact of the toxic stress these families have endured over the past year will probably not be known for many years. Domestic violence and child abuse is on the rise, but much of it is going unreported because of the enforced isolation. Low-wage jobs dominate the employment landscape in Indian River County, with 67% of all jobs paying less than $20 per hour, and 3/4 of these jobs paying less than $15 an hour. Locally, half of all jobs in the county pay less than $13.60 an hour. Many of these families are renters, which results in a very transient lifestyle. That means moving frequently, and that has a direct impact on a child's academic performance and jeopardizes their connections with teachers and friends. Today, an individual needs to work 83 hours per week at a minimum wage job in order to afford a fair market value 2-bedroom apartment in Indian River County. As you can see, you, I, and all of Florida need these families to succeed. In a state like ours that relies on hospitality and tourism, when we ignore Alice, we risk the future well-being of our community. Our families, our community, and our economy cannot succeed if the number of hardworking families are unable to afford the basics continues to grow. So as the needs assessment indicated, we have some persistent challenges for Indian River County residents. One of the biggest is the lack of safe and affordable housing. Last year, we had 1,379 homeless individuals. 358 of those were children. Since the start of the pandemic, we have provided over 700 households with rent or mortgage assistance. There remains a stay on evictions, so we have yet to see how bad the housing crisis can get. There is huge shortage of inventory for these working families in our community. So if they do in fact get evicted, there are very few options that they can afford. Our conservative estimates guess that we have about 1,500 to 2,500 cost burden households in our community. So the need is much greater than we anticipated. The snowball effect of losing a place to live is a lot more than we can discuss today. But as you can see, the housing crisis directly impacts our community. Only half of our incoming kindergartners are ready and prepared for school. Starting them out behind often creates challenges of constantly playing catch up for the student as well as the teacher. We know that third grade reading scores are the largest predictor of future school success, and only 60% of our third graders are performing on grade level. We continue to have higher than state averages on substance abuse. While smoking has decreased, there has been a huge increase in vaping, up from 12% to 25% in just 2 years. And our teen pregnancy rates remain very high, as do the dropout rates. Access to services, the location of providers, hours available, and transportation to these offices often hinder ability to seek care in our community for many individuals. We have fewer healthcare providers, especially mental health professionals, than state and national ratios. Out of 67 counties in Florida, Indian River County ranks 21st in overall health. Has anyone ever tried to take the GO line? Well, we are very fortunate to have a free transportation system in Indian River County. It can often take hours for low and middle income workers to get to an appointment by utilizing the GO line. They need to take a day off work because our system of care is very fragmented all across the county. This is where we need that coordination and collaboration among service providers. It is essential. This fractured system of care in our small community, we have many organizations vying for funding and see each other as competitors rather than looking for collaborative opportunities. As funders and donors, we need to encourage this more. The long-standing systemic health and social inequalities have put many people from socioeconomic, racial, and ethnic minority groups at increased risk for contracting COVID-19. The social determinants of health have historically prevented them from having fair opportunities for economic, physical, and emotional health. Inequalities in the social determinants of health, such as poverty and healthcare access, affecting these groups are interrelated and influence a wide range of quality of life outcomes. There's no coincidence that the Alice population is given a woman's name. We know that women have been impacted at a greater rate, either as frontline workers in healthcare or in teaching, or they're the parents that have needed to give up their jobs in order to stay home and oversee virtual school or provide childcare. The pandemic has definitely shown a spotlight on the inequality in America. School closures and school isolation have affected all students, but particularly those living in poverty, adding a lot of damage to their learning. And the mental health crisis is emerging as one of the biggest issues for many students who have lost access to the services that were offered in their school. Reduced learning time has impeded a student's learning and has also affected the development of the whole child. Once the pandemic allows it, we will need to make up for this time by increasing both the amount and the quality of learning time through extended schedules, summer enrichment, after-school activities, more personalized instruction, and staffing strategies that reduce class size. And we need to be able to staff schools with sufficient and highly credited educators. Things like the lift zones that Xfinity is creating are community centers where a lot of these low-income children can access the internet and also connect to their teachers. But additionally, it allows their families to access healthcare services through telemedicine. The prevalence of mental health systems has increased already from 1 in 5 people to 2 in 5 people. Substance abuse locally has doubled. More frightening is that 10.7% of local respondents reported suicidal ideation in the past 30 days, up from less than 4% pre-COVID. The long-term impact of this is very hard to predict. In some research that came out in New Orleans on the mental and physical health indicators of Katrina survivors, the issues truly didn't present until 15 months after the storm. The CDC revealed that more than 50% of that city's residents showed signs of a critical need for mental health treatment. And if you consider that we are not yet past the storm of COVID, the need for these services will continue to rise. Indian River County is very fortunate to have both small and large donors that are very generous with their time and financial support. Included among them are some of the highest income residents in the country, many of whom are committed to meeting the needs of the vulnerable families that we have here. Many of our community's best ideas and promising practices have resulted from this generosity. As we wade through the recovery efforts, we must keep generosity at the forefront as a targeted approach to address many of the inequalities identified in the needs assessment, and it also take into consideration some of the lessons learned from the COVID experience. And next up, Mary Blair is going to talk more about our grants.
Hi. Unmute. While we're waiting, I just wanted to say hi to the audience. I recognize from looking at the participants, and I'm very happy to see that many of the women who are serving as panel chairs, financial advisors, and panel team members are on this call, in addition to women who are new to me and I'm hoping are interested in perhaps joining a panel last year. To my current panel team folks, please forgive me if some of this information is a little repetitive, but I hope I've put in enough new bits of information to keep it interesting for you. For those of you out there that are new to information about grants, we have 8 panel teams in operation right now. We did our training in December and our first site visits were conducted this week. 52 women in total are manning or womaning these teams to go out and visit our nonprofits. And we're especially cognizant of training everyone the same to ensure the consistency of evaluation and process across our teams. Next slide, Dee. Wanted to let you know that, as you might expect, with such a critical year as COVID and how it has affected our nonprofits, this year we have double the applications than we have received in the previous 2 years. I look at that as an opportunity to double our impact within the community. Next. By focus area, our proposed grants break down as follows: 0% in the arts and culture arena, 5% in the environment focus area. The bulk of our proposed grants are coming exactly in the areas that Meredith was just informing you are the areas where we have the most critical need. 21% children and families, 32% education, and 42% in the arena of health and wellness. A snapshot of our current nonprofit applicants in this grant cycle. 37% have previously received a $100,000 impact grant. 21% have previously been a finalist but did not win the $100,000 grant and became merit grant winners. And 42% have never been a finalist or are new to impact. I think it makes for a nice mixture of grants in our process. It's okay to go to the next slide, Dee. When I conducted the training of the panel members, I got some feedback, which I thought was interesting, that perhaps some folks felt that if someone had won before, even more than once, perhaps that was not a good indication. And when I reflected on it, I look at it as a wonderful indication. The continuity of relationships with our nonprofits, I think, only are more impactful in general for Indian River County. And I'm going to show you 2 different examples. One, the Treasure Coast Food Bank. In 2009, which was our inaugural year as Impact 100 of Evian River County, Treasure Coast Food Bank received a $100,000 grant for the Backpack Buddies program. This is a program which sent school children home on weekends with backpacks filled with nourishing food to get them through the weekend. 500 students per weekend were served by this program. I can only imagine how many children have been served by this program, as it probably has continued since 2009. But interestingly, we continue our relationship with Treasure Coast Food Bank because they are a viable, capable, strong organization. In 2020, this last year, we were able to give them another $100,000 grant for the Mobile Mercado. The Mobile Mercado is a literal grocery store on wheels, which travels to our most needy residents in what we call food desert neighborhoods. As you can see, 800 residents are going to be served yearly. And in addition to being able to come on this mobile truck to purchase groceries, it is also a SNAP, AKA food stamp access center, where families, individuals who are not part of the food stamp program yet can sign up on the spot. They will not be turned away from receiving food. Next slide, Dee. Another continuity of relationship nonprofit is the Treasure Coast Community Health Group. In 2011, we funded them with a $100,000 grant to further outfit the dental offices for their Fellsmere and Oslo facilities. And because of this, they were able to accommodate 800 to 1,200 extra patient visits per year. In 2020, Treasure Coast Community Health partnered with Children's Home Society to institute a program at Dodgertown Elementary, and 360 students at Dodgertown Elementary in Gifford, which is an underperforming school, have access to medical and dental. Next slide. The 2021 grant proposals are continuing to address the needs that Meredith spoke about. As you know, it's kind of an impact philosophy or practice that we do not discuss the actual names of the organizations that have applied for grants until the season is completed. But I just wanted to give you a hint of some of the projects that we are looking at this season. And the first ones deal with that very critical area that Meredith mentioned in terms of lack of access to care for medical, dental, and mental health within Indian River County. We have one project the teams are looking at that is an all-inclusive access to care program for low-income families. This includes medical, dental, mental health, food, housing, transport, plus. Amazing project. Project number 2 in the health and wellness arena is a mobile medical unit, which will go to people where they live to test, treat, and educate for infectious diseases, and this includes COVID. Next slide, Dee. In the arena of children not being prepared for school or not having adequate before and after school opportunities, we have 2 projects that are looking at those needs. Project number 3 is a preschool booster program in which moms are trained to serve as the primary drivers for the kindergarten readiness of their children. And project number 4 is an after-school vocational training program for low-income youth. This is beyond homework help. This is real, literally on-the-job training that prepares students to begin work in vocational programs and be able to provide for their families with good paying jobs that don't involve college, because certainly not everyone is meant for college. Next. For those of you who are new to grants or don't know much about it, it's important to note that this was an auspicious year for us. After 12 years of paper applications, we went online. We significantly streamlined the application for our nonprofits to make it less onerous, and we hope more focused. Along those lines, we reduced the application. Instead of asking 24 narrative questions, in addition to collecting nuts and bolts information, we pared it down to 12 what we felt were essential questions. And let me just give you an idea of what those questions are so you can see the type of information we're gathering from our nonprofits. I'll go through this pretty quickly since many of you on the call I know are very familiar with the application. Number one, we ask for the organizations to describe their mission. We ask them to provide a brief summary of the organization itself, including its history, its main programs, its accomplishments, and the populations served. Two new questions, though, this year, which we felt helped pivot to what organizations were experiencing due to COVID, were just very upfront. How has your organization been affected by the COVID-19 crisis? And as a follow-up to that question, number 4, what challenges do you foresee for your organization in the next 6 to 12 months? Because we certainly know this crisis is not over, and we have a long way to go. Next slide. Fifth question is we ask the organizations to give us a summary of their project. We ask them to explain the need they've identified, the exact population they plan to serve, and then a new question for us this year, which has proved to be quite popular and quite telling, is just to allow the organization to plainly talk and tell us a story from soup to nuts, from beginning to end. What is this project all about? Why is it important? Basically, we ask the organizations to put on 2 different types of caps. The journalist who answers the question who, what, where, and why, because that's the basic part of the story, but then the anecdotes, the heart of the story, something that will capture hearts and minds. And this has proven to be very, very useful, I think, to our panels in getting a better grip on what the organizations are trying to accomplish. Next slide. You'll notice I've highlighted 3 things in blue: high impact, organizational strength, and sustain. And that'll be explained a little bit further on another slide. But number 9 question, what makes this a high impact grant? A new question this year, how do you define success for this project? Another new question for this year, we asked the organizations to specifically describe the operating procedures and governance practices so that we can feel good that they are an organization that is capable of managing a $100,000 grant. Many of these organizations are doing phenomenal work, believe it or not, on $300,000, $400,000, $500,000 budgets overall, and $100,000 is life-altering to them. Finally, what is your plan to sustain the proposed project after the 2-year impact funding period has ended? Next. Another thing we did this year, which I think has proved to be quite helpful to both us and our applicants, is the availability of uploading information that's helpful. Recent press, annual reports, photos and videos, data or research, which is related to a proposed project, organizational charts, and job descriptions. Previously, these things we had to go and search out ourselves if we were so inclined. And, you know, the job of grant reviewing is pretty onerous in itself. So it's really wonderful that the organization can direct us to things that are helpful and important and so easy for us to access that information that they need us to know. Next. I also want to assure all of you out there who are not grant panel members that I think perhaps one of the most important differences between Impact and other organizations that I've been affiliated with is the truly rigorous financial review that our panel teams put the nonprofits through. The questions on the application are certainly wonderful and very helpful in understanding an organization, but they certainly don't tell the whole story. And I don't know if Heidi and Anne are on the call. I know they had signed up for it, but they are 2 of our financial advisors for this year and are great examples of the women who have fabulous financial backgrounds, CFOs of companies, coursework from major colleges and universities. They are looking at years of income tax returns, years of financial statements, and really digging into the organizational and financial strengths of the organization. So I need members out there to feel really assured that things are being looked at very carefully, and the $100,000 that we impart to organizations, we only give out these grants if we feel these organizations truly have the stamina and rigor of their own interior controls to manage the money. Next. The reason I pointed out high impact organizational capability and sustainability as 3 of our questions is because to both our nonprofits and our panel teams, this is the consistent message. A project or program that is worthy of a $100,000 Impact 100 grant has high impact. And as you can see by the icon, when that pebble drops into the water, it's not just a plunk in the water, it's a ripple and a ripple and a ripple. As Gladys likes to say, it's the gift that keeps on giving. I've got my Rosie the Riveter there because we need to know that our nonprofits are organizationally capable of managing the grant and also being alive at least 2 years and well past the 2-year period where they're going to be implementing our grant money. And then certainly the sustainability of the project. We don't want it to be over after $100,000 is expended. We want it to continue on. Next. My message today is if you're perhaps a new person thinking about joining Impact, join. And if you have yet to renew, please renew today. As I mentioned earlier, we have double the amount of grants this year than we have received in previous years. Many of these nonprofit organizations held or should have held their major fundraising initiatives in February, March, and April last spring. And obviously because of COVID, those things had to be canceled. I would hate that it's such a year when the need is great and the organizations are working with less money in their coffers, that our membership should be in decline. Right now, I think we may have enough for 3 grants. I would love to be able to know come April that there's enough money in the bank that we might give out at least 4 or maybe 5 grants to these deserving organizations. So membership dollars equal available grants we can give. And I really implore folks that in this time when it even may be a little more difficult for you, and it's certainly perhaps not as much fun to be doing things virtually, not to be enjoying being together in person for Impact Day or potentially meet the finalist or potentially the vote, that you still recognize the need. And without all the bells and whistles, it's still a wonderful organization and we do wonderful work. And like I said, one more time, the need is especially great this year. So thank you.
Great job, Mary.
All right.
Yes, I have gotten back. It's really sad commentary on life when you have to have technology, emergency equipment tucked in your closet. So I found a MiFi that I got hooked up to because apparently the server has crashed because we're getting a terrible storm up here. So do we have any questions for Meredith or Mary? You can post them in the chat room and I can field them to the right person.
I don't see that we have any questions yet. If anybody has any questions, we're standing by.
Okay, as you think of some questions, I'm sure Meredith and Mary have provoked some of your interest in these areas. I would just like to ask you that after you heard everything that Meredith said about the needs assessment and what you've heard Mary say about our grants process and the number of grants we have this year, I would hope that all of you would consider joining Impact 100 if you have not so joined at this moment. We are in a unique position to fund $100,000 grants and to make a difference. This is a very special organization, and I hope all of you have gotten that our speakers today have made that very, very clear. And I prepared a slide that Dee has up on the screen. And I went through 12 years worth of grants that we have given out. And if you look at these statistics, you'll see a number of organizations that we've given to, a variety of organizations, and you will see the number of lives that we have touched. And what's even more compelling is that this is the number of lives per year since the grant was made. We are so unique in that we allow our members to select who are the grant recipients. That is something that a lot of other funders do not do. I like to say, as Mary said, that we are the gift that keeps on giving, but I had another thought today, that we are like the ever-ready bunny of funders. We just keep giving money, and the effects just keep going on and on. So I would ask that if you've joined our team, a very big thank you, and go find a friend to join also. And if you have not joined, bring along a friend and both of you join. The need has never been more critical, and Impact 100 makes the difference in Indian River County, not just a difference. So I would like you all to join us for part 2 of Impact Day on February 3rd at 4 p.m. Go to our website and register now. It promises to be very entertaining and very original, and you will see your grant dollars at work. So I'm going to check and see if there's any questions.
We did have one question. Is there a possibility to request members to double their donation in this year of more need? So if there's a member out there that would like to give more, is that possible?
Well, yes, they would get a very big hug from me. And the bad part about that is you only get 1 vote still. So yes, you can double down if you would like. We would love you to, but you still only get 1 vote. And we have a question from Lalita Janki to the panelists, that she has heard the Alice information some years ago. Has there been any change in numbers? Meredith?
So yes, there has been some changes in numbers, not significantly. The fluctuations in Alice numbers has really been between the number of families at below poverty and the number of families on the cusp of Alice. So again, that goes back to the seasonal nature of the employees that work here, because they could, have a good season or switch restaurants. So the number of Alice families and the number of below poverty families has always really hovered around that 44, 45, and 50% since we've been tracking Alice since 2007.
And we had another question about when is the annual meeting. That is April 22nd, I believe. And we will announce our finalists on February 3rd. So there's a lot of work going on right now by our grants panels and by Mary Blair and her committee. So are there any other questions? Okay, if not, I'm going to thank all of you for attending and listening to what we have to say. And don't forget, mark your calendars, February 3rd at 4 p.m. And you will actually see our 5 winners from last year with their projects at work. So again, I thank you for attending today.
Thanks, everyone. Bye.
Bye.